Good evening, everyone. I am so happy to see you all in the room. And we are starting our team training Thursday, the event that I also call Applied Neolife. And that is simply for us to know how to use our amazing products and our lifestyle opportunity in common and everyday events and situations and circumstances. Today, I thought that it would be important to discuss urinary tract infections, basically because they are very common. And also to remind you that we are not into medicating and treating. This is purely nutrition and lifestyle advice. If you need to see a doctor, please do. I'm not going to go into that, but I would advise if you really seriously need to see a doctor, please do that. We are here to talk about ways to prevent. My name is Esa Zanambasi. I am a medical doctor by training. However, by passion, I believe it is important to prevent problems. So I have a brand that I call Simply Healthier. And thanks to Neolife, I have learned that it is possible to prevent a lot of challenges that we see day to day. So I hope you like my introductory picture. It is just to show you what we are going to talk about. Now, as a way of introduction, urinary tract infections are very common, especially in women. And to describe it as recurrent, it is for those who are treated more than twice in 6 months. I'm sure some people are treated so frequently that they literally are on antibiotics all the time and are not having a very good quality of life as a result. Now, talking of antibiotics, there is a tendency to overuse antibiotics, and this in itself could be a factor leading to frequent urinary tract infections, UTI. As a result of that, we are seeing a lot of antimicrobial or antibiotic resistance, and it's a cause for concern. So my wanting to apply Neolife to this is with that background in mind. Now, what is UTI? What is urinary tract infection? It is essentially buildup of unhealthy bacteria anywhere in the urinary tract that then leads to infection. The urinary tract is loosely divided into upper tract, which are the ureters and kidneys, and the lower tract, the bladder and the urethra. And for men, that also includes the prostate gland as well. Right, so urinary tract infections are more common in women. I've said that, but I'm emphasizing that. But the reason is due to the anatomical structure. The urethra is shorter in women, and there's also proximity to the anus and the vagina, which are areas that have a lot of bacteria in them. So that is what we're talking about. A bladder looks something like that, but that was an artist's impression. But anatomically, you can see your glands, and then you have these big blood vessels, the big blood vessels, and then of course the bladder. And because of these big blood vessels, should there be an infection in the kidneys, it can actually gain access into the big blood vessels and quickly spread around the body in the form of septicemia. So what we are talking about is not a frivolous topic. It is actually a very important topic. Now, this is the bladder, the anatomy of the bladder. And as you can see, there is quite a lot of muscle that is important. There's also this layer that we call the fat layer. And the reason I'm showing you these pictures is so that you get an idea of just how important it is to nourish yourself properly and how important lifestyle overall it is. Then as for the men, gentlemen, the importance of maintaining overall health for the sake of your prostate cannot be overemphasized, because if your overall health is not good, for example, if you're being exposed to too much too many toxins and xenoestrogens, those are the outside estrogens, those cause the prostate to swell. And so with age, your bladder emptying can be compromised if the prostate swells. Now, I know you all have heard of somebody or some people that have challenges with that particular organ. Now, let's talk a little bit about symptoms of UTI, urinary tract infection. And as I go through them, I'm sure you will say, yeah, you can relate or have heard of a friend or family with something like that, okay? Frequent need to pass urine, urge to pass urine, but little or no urine is passed. Sense of incomplete emptying of the bladder, pain, burning or discomfort on urinating, in other words, abdominal pain, it can be generalized or localized. Pain in the sides or upper back, that's generally where the kidneys are located. Cramping, it can be aggravated after sex, and that is important to take a proper history. And then of course, the urine itself might be cloudy or smelly, and then there might be blood in the urine, or they might be constitutional symptoms, generalized malaise, fever, chronic fatigue, nausea, and or vomiting. So we are dealing with a lot, but I want us to remember quickly that 95% of all chronic disease comes from food choice, toxic ingredients, and lack of exercise. I just thought I would slip that in there quickly so that lest we forget what we are about to make the world healthier and happier through prevention. Now, some tips to prevent UTI. And, you know, these sound simple, and that's because they are simple. But if we don't take care of them, if we don't look after the simple things, then when they become complex, those become even harder to look after. And that's why I have this phrase that says, please don't outsource your health. Start with what you can, and then when it becomes difficult, you can ask for help. So the use of unscented bath products that are pH balanced, that's a good tip. Then please wear clothes that allow ventilation, avoid skinny jeans, tights, and all those, because the most common bacterium that causes UTI is called E. coli. It thrives in moist, warm places, okay? And there's a lot of it in our gut. So because of the proximity, it is right there. Then, of course, wear undies that breathe, eh? Avoid synthetic fabrics. You know, that sounds funny advice, but please be very careful. Rather spend a little bit more on cotton, pure cotton, which is a natural fiber, and it allows airflow so that you keep that area cool and dry to avoid the growth of bacteria, the overgrowth of the wrong bacteria. And then wash your undies with mild unscented detergents to avoid irritation. Sounds simple, but that's what we want to share with you. If there are any guests here, you're about to see what we have. And then some more tips. Hygiene, yeah, that sounds like common sense. But we need to teach our children from an early age the importance of hygiene, and especially the girls to remember to wipe not back to front, but from front to back, okay? And wherever practicable, to actually wash. And then avoid products that are harmful to healthy bacteria in that area. Things like douches, those are sold over the counter even. Powders, sprays, crazy things like that. Sometimes all you need is water, promise you, or non-toxic soap and water, which we will share with you. These products can lead to harmful bacterial overgrowth that cause recurrent UTI. And then, of course, the food that you eat. Very, very important. The food that you eat. Remember to include in your diet probiotic-rich foods to encourage healthy bacteria to grow, to live in your gut. Things like yogurt, fermented foods like sauerkraut, foods rich in fiber, natural foods. In other words, avoid synthetic foods and over-processed foods. And then finally, please drink plenty of water. And I put water in bold because I don't want you to say you're drinking water when you're in fact drinking too much soda. So whatever you're drinking, not sweetened, not preserved. You can add some lemon, that gives it a nice flavor, some cucumber, some mint and things like that. And then I've added here, use ceramic or glass containers, and please try to avoid plastic because that encourages too much of the xenoestrogens into your system. So lots of tips. Now, I just want to turn to the nutrition and the power of nutrition to beat urinary tract infection. There was actually a study that was done in Canada that showed that cranberries and cranberry juice have enzymes that limit the ability of this particular bacterium, E. coli, from binding to the cells in the urinary tract, in the bladder and in the urethra, so that as you drink water, the body can flush it out. So cranberries, and so I went into our range of products to look where cranberries are, and I'm about to show you. By ensuring that your immune system is strong, any bacteria would be dealt with quickly before there is a need to resort to antibiotics. So remember that your body has the intelligence, your immune system has the intelligence to recognize things that are not of the body and to deal with them, as long as you provide the wherewithal to do that. So just to remind you and to tell you that this is the product. If you look at the ingredient list, the ingredients, the first thing on there is cranberries. And as you all know, we are blessed to be part of a company whose product supply and technology for producing these products is phenomenal. Okay, so it is flavonoid complex is a water-soluble antioxidant complex from fruit and vegetables. And the first item I saw there was cranberries. So this is very, very important for UTIs. Now, the power of nutrition. Remember your vitamins, A, D, E, and K. Those are the fat-soluble vitamins. And I'm putting them up there because vitamin A and D are very important for the immune system. Vitamin E as well helps with blood supply. But because they're fat soluble, remember in the bladder is that layer of fat, which needs to be fed, nourished, protected. Then vitamin B and C, very, very important. Those are water-soluble vitamins. And the whole of the urinary tract deals with water, and it needs a lot of energy to do that. So that's where you need your B vitamins to supply the energy to those cells. And of course, the C vitamins, the vitamin C, is also a complex. It works together with flavonoid. You need that to build the actual structure of each and every component of the urinary tract. And the bladder, because it has to be able to expand or to stretch and then to contract, and the muscle to really squeeze the urine out fully, you need good quality collagen. And vitamin C makes your collagen with all the other things, namely minerals. You will need calcium, magnesium, zinc, and others as well. The essential fatty acids, you need your lipids and sterols. You need your omega-3, which is anti-inflammatory. And then, of course, you need amino acids. Those are the building blocks of proteins for all, absolutely all important bodily functions. So some of you may have seen people who swell, who get swelling of the legs, swelling of the feet, puffy eyes. That's an indication that the kidneys might not be coping with excretion of excess fluid, and that could very well be because they're lacking nutrients and especially amino acids. So in talking applied near life, I want you to see the bigger picture. So let's talk about TreeNN, which is our flagship product. How does it work? Good nutrition begins at the cellular level. And Near Life is the world's leading company as far as cellular nutrition is concerned. So we need nutrients to get into cells and waste matter to get out. And that is what the urinary tract infection is all about, getting waste matter out. So let's look after it. Then, of course, antioxidants. I've talked about them. Carotenoid complex, I've mentioned flavonoid. I'll mention it again. But we need the immune system to be up. And that's why I put this one up. Carotenoid complex helps to improve immunity by 37% in 20 days. And each box of Pro Vitality has TreeNN, it has carotenoid complex, it also has omega-3, anti-inflammatory, and the vitamins and minerals. So there you have it. We call that the core nutrition together with the amino acids in the form of the shakes. We have NutriShake and Your Life Shake. Now, key to prevention of any disease is to ensure that the immune system has the tools required to remain vigilant. Very, very important. And if you followed from the beginning, I really laid the foundation as to why the urinary tract infection is prone to infections. So, in addition, in importance are diet, restoration and relaxation. You need to be able to rest and relax. Exercise, stress management, and supplementation to fill those dietary gaps. So we have something for children. Yes, the kids also have a urinary tract infection, obviously, a rather system. And we want to avoid infections in children early, and especially in girl children, because they haven't grown up yet, they're still immature, and they are very, very prone to that. And in my clinical practice, I remember we used to be distressed by little girls having that challenge of urinary tract infections. Vitamin C, I've mentioned. Flavonoid. Now, vitamin C and flavonoid work together, and they are very, very protective. Aloe vera, very, very soothing. We said one of the issues or symptoms is cramping, and aloe vera helps with relieving those cramps. It has chamomile in it. It has a lot of other things that are very useful for relief of urinary tract infections. So yes, aloe vera is a good product. And then personal and skin care. We have, by avoiding toxins, remember, but then we have personal care products that are pH balanced. That is so, so important. They are non-toxic and they are 100% biodegradable, which means they will not kill normal bacteria, but they are in the environment, they become degraded without killing normal bacteria. So I talked about scents. You will find that our products are very, very lightly fragrance, if at all, and they use permissible fragrances, nothing that is going to cause problems. So we actually have come to the end of our presentation because I want to give a few moments for any questions, but I just wanted us to remember that you can't expect to see change if you never do anything differently. I didn't project G1 laundry, but I did say that that is important for ensuring that your laundry is done with the best non-toxic products. Okay, so if there are any comments, questions, anything that you want cleared up, I'm happy to answer the questions, or we can have a lively discussion.